Again, so good afternoon and prior to evening, everyone. Yours truly will be your professor for nursing pharmacology, and this is Nursing Care Management 106, NPH 00. So we are about to start primarily our discussion on the basic concepts and principle of nursing pharmacology. And every time that we hold our discussion, we will present the learning outcomes that are expected to be learned obviously by our students. When it comes to the learning outcomes, every time that we have our discussion, every end of the topic, it is given with the relevant and actual simulated situation conditions. The students will be able to first primarily explain the meaning of pharmacotherapeutics, pharmacokinetics, and pharmacodynamics. These terms are terms which is usually introduced when you enter in the course of pharmacology, because this basic knowledge and concept will give you a better understanding as we go along with the classification of drugs. Sir, what does basically the meaning of the pharmacotherapeutics, pharmacokinetics, and pharmacodynamics? So very obviously that this term starts with pharmaco, and the pharmaco are terms that are related and associated with medications, with drugs. How about, sir, the differences between pharmacotherapeutics, pharmacokinetics, and pharmacodynamics? Okay, if we talk about pharmacotherapeutics, you've heard about in some of the advertisements about no approved therapeutic claims. Ito po ay gamot na hindi nakakagamot sa mga sakit na mga ganyan. Yan, di ba? So, why, with what could be the term therapeutic means? If we consider the term therapeutics, it means that there is or there are specific indications of how the drug will work for certain condition. Example, a drug such as ambroxol. I know you're familiar with ambroxol, but when you've heard about ambroxol, what could be the indication of the drug? Anyone? Anyone? Any answer me do? If you've heard about ambroxol, I know some of you have taken up this drug.
For cough po ba yun?
Yeah, so definitely for cough. Okay. So if it is for cough, what could be the involved system of the body? What could be the involved system of the body?
Respiratory system.
Respiratory system.
Lungs
Very good.
po.
Very good. Lungs. Okay. So you're getting there. You're getting there. So when it comes to the cough, okay, when it comes to the cough usually manifests as a normal response of the body to clear the airway. And the coughing reflex are obviously on the upper respiratory tract. So, sir, what are you telling po? Class, try to go back on the basic learning and concepts about anatomy and physiology. Kasi you've heard about the ambroxol. So you have mentioned about its for cough. Do we have a coughing reflex? Yes. When do coughing reflex happen? During the time that there are obstruction on the airway passages. What are the reasons of obstruction in the airway passages that will stimulate coughing reflex? One of which could be phlegm, secretions. Okay? With the secretions present in the airway passages, and since we have talked about airway passages, I have asked you what system is involved. You have mentioned about and answered respiratory system. Since you are aware now that the drug is indicated, obviously involving respiratory system, involving airway passages, and the airway passages that we're talking about is on the upper respiratory tract. It is a matter that the coughing is stimulated. Okay, the coughing is stimulated because if there are obstructions, and we have identified many reasons or factors that may cause obstructions, and one of which is mucus secretions. So on that matter, on that basic analysis, ambroxol is actually a mucolytic. If we say mucolytic, from the term itself, mucus. Okay, mucus secretion. Any drug that you may encounter that has lytic, it means that this term is used as either it is block or either it inhibit the action of it. So just like a typical example that I have mentioned to you, mucolytic. Lytic inhibits mucus secretion. So it inhibits the production of mucus secretions. So on that note, the indication of the drug is more clear. Okay, more clear. It could be layman's, and the nurse can easily explain it to the patient. So what pharmacotherapeutic, how pharmacotherapeutic is related to the concepts that I have mentioned about ambroxol. If we say pharmacotherapeutic, I mentioned ambroxol, it popped to your mind, it's for cough. You may not even mention it that it's for appetite. You have not even mentioned that it is for hyperacidity. You did not even mention that it's for constipation because you have been oriented that the ambroxol is for cough. The therapeutic concept that I'm talking about is we are talking about that the drug such as the ambroxol, its therapeutic effect is to inhibit mucus, inhibit, increase mucus production that obstructs airway passages. Why it is called as for cough? Because the production of secretions obviously may stimulate the coughing reflex as a normal response. But the point is, you keep on coughing because the airway passages are obstructed. Then the ambroxol, the purpose of the ambroxol is to what? To relieve or to remove, to liquefy the cause of obstruction so that it will not stimulate the coughing reflex. So that's what we meant by pharmacotherapeutic. You are aware that this drug is for coughing, and now with your analysis, with your critical and analytical thinking, it will give you the confidence on how you will explain it in a layman's to anyone who may ask about ambroxol. In the future, as you end up this course, you may not just only respond accordingly that ambroxol is for cough. You may respond in this way probably with your confidence. Ma, ambroxol is a mucolytic. Lytic meaning inhibit, muco meaning mucus secretion. We are oriented, ma, that the ambroxol is usually indicated for persons with cough. And the cause of the coughing is brought about by the increased production of mucus secretion. That's why, ma, mucolytic, this drug will inhibit the production of mucus secretion that causes the stimulation of coughing reflex. So it will liquefy this secretion so that it will relieve the cough you are experiencing. Oh, come on. Nurses, this confidence that you may have in just singly explaining a drug that is very clearly to a person who is asking it is a great help for them. It may not just a responda, it is just for cough, but mainly you give them the information that they may need because you are talking about a deeper explanation involving the physiologic and the anatomical perspective of how the ambroxol acts to the body. Now, you even encounter situations like no approved therapeutic claims. So we have mentioned that. That's why there are some herbal drugs, diet supplements, multivitamins that are also approved by the Food and Drug Administration of the Philippines But why, sir, there is in the advertisement indicating no approved therapeutic claims? Because it is on the perspective that the multivitamins is not okay, did not or may not identify specific treatment of health condition. Kaya it is always emphasized na ito po ay gamot na hindi nakakapagaling ng anong kondisyon. It means that it is just a supplement. It is not an indication as a treatment of a certain or particular disease or condition. But still, on the premise that it is approved for circulation in the market, which is safe for the people to take because it is approved by the Food and Drug Administration. Before I have those misconceptions, bakit no approved therapeutic claims? No approved therapeutic claims. Yung pala, the key term there is the therapeutic. It means that there is no specific approved that this drug will be considered as treatment. Kaya that's why no one can claim that, for example, can you give me an example of multivitamins?
Enervon po, Doc.
Okay, for example, yeah, Enervon C. Pag sinabi mo Enervon C, Enervon C could be a treatment or indicated for stroke. This drug company may not claim that. Okay? Pwedeng it may also say na no approved therapeutic claims for Ambroxol can be Enervon C could be a drug for immune system. Very broad. Okay, very broad in nature. But the Enervon C with the vitamin C, it supports our missing reserve of vitamin C in the body to boost immune system, but not merely to treat. Okay, to treat immune-related diseases. So that comes it with no approved therapeutic claims. Okay? Any questions? Students, any questions? No questions? I'm not hearing anything. Okay, none. How about pharmacokinetics? Okay. We will relate what pharmacokinetics and pharmacodynamics are associated with each other. So obviously it starts with pharmaco. I know you have encountered kinetics and dynamics in science. Both are related in movement. Okay? When we talk about pharmacokinetics, this talks about the movement of the drug. From the time that the drug enters to any route of administration, example, if it is oral, so obviously it's taken by mouth. From the time that the drug is taken by mouth and proceed to the different parts of the body, its movement per se, before it will reach the plasma, which is the basic component of the blood, is the study referring to pharmacokinetics. Under pharmacokinetics, we have the what we call ADME. A-D-M-E. A stands for absorption, D stands for distribution, M stands for metabolism, and E stands for elimination. So from that basic perspective and concept that I have mentioned about pharmacokinetics, if the drug enters the body, for example, you have taken a paracetamol, which is obviously a drug that is used as for pain relief. It is also used as antipyretic for fever. So if it is indicated for oral, so obviously the drug starts its absorption from the mouth, since it will enter going to the gastrointestinal tract. So obviously we expect from the mouth goes to what part of the body? From the mouth, as it swallows, it goes where? It goes where? When you swallow anything, it goes where?
Esophagus.
From the esophagus, it goes lower
Stomach po.
Tama.
Stomach. Very good. So it goes to the stomach. Once it goes to the stomach, there is a possibility that the drug may interact with the hydrochloric acid, 'di ba? The pH orientation of the stomach is acidic because obviously of the presence of the hydrochloric or secretion of the hydrochloric acid. Do you think the hydrochloric acid may contribute to the breakdown of the tablet that you have taken in the stomach? Do you
Yes
think it
po.
has a relationship? To what extent that it will have a relationship? The too much the acid pH level in the stomach may contribute to the breakdown of the components before it will be what? It will be absorbed to the intestine. Because once it will be absorbed to the intestine, that is the time that it will come to a point that the liver, okay, after intestine, the liver will detoxify the drug. Because class, let's put this in mind that not all of us may have the same level of need when it comes to drug. The two major organs that are very significant when it comes to the absorption, distribution, metabolism, and elimination are the liver and the kidney. The liver, with its action as with its action on detoxification, there are certain level of paracetamol that the body can tolerate. Because once this paracetamol the paracetamol will not be detoxified by the liver, there could be instances that it may reach its drug toxicity level, which is obviously harmful to the body. So if the liver identifies that the level or the chemical properties and level of drug that is only essential for that patient is this amount, volume, properties, then that's the action of the liver. The excess properties of the drug, components of the drug, will need to be removed out of the body. How this drug could be eliminated out of the body? So it's obviously one of the excretory organ that we are aware of is basically the kidneys. The kidneys will be the one who will function to remove those excess properties of the drug that may not be needed by the body to avoid toxic level, so it will pass via urine. That's why, okay, there are some instances that when you take a drug, there are situations that it leaded to discoloration of urine. Did you observe that? Did you observe that?
Yes po,
Yes
Dean.
po.
Yeah. What are the common drugs which somehow you have taken and observed that there are discoloration in your urine as the as not usual?
Din po usually ang napapansin ko po is yung sa mga multivitamins.
Yeah, exactly. If you will notice when you take most yan, ascorbic or multivitamins, di ba usually nagko-cause yan ng almost yellowish color na ng urine ninyo, or hindi naman dark but almost yellowish to luminous color of the urine, because that is the action of the detoxification of the liver, and eventually the action of excretion of excess properties and chemical properties of the drug via the urine. To what extent, sir? Because as what I've told you, when you take them, when you're taking multivitamins, class, our body has reserve also of vitamins and minerals. Why we're taking multivitamins? Because the term used are supplements. We term it as supplements because it is carried by the body to support what could be consumed, what could be needed by the body, but not 100% of the drug must be retained with the body because we still have reserve vitamins and minerals. Vitamins and minerals are very much common prescribed to those who are more active physically when it comes to work, when it comes to stress, when it comes to, for example, situations like pregnants who are experiencing anxieties. Why those multivitamins are more important for them? It's because with their situations, physical activities, what do you expect for a person who are engaged into tedious physical activities? Do the person may have increase in metabolic activity or decreased metabolic activity? If you are engaged into active physical activities, do the body respond to increase metabolic activities or metabolic response or
Increase
decrease
po.
metabolic response? Answer.
Increase po.
Increase.
Increase. Okay. Some
Increase
answers,
po.
Chris. Chris lang. Chris. Nawawala yung in or de. Chris.
In po. Increase.
Increase po.
Okay. Increase. Very good. Kasi just like for the situations like class, when you're engaged into physical activity, what happens to your heart? It will contract fast or slow?
Fast po.
Fast. Very good. That's an indication that your heart is keep on giving volume of blood because the cells are almost have a fast pace of consuming oxygen. So the heart must pump immediately. It will increase its workload so that to increase also the ejection of blood to the different tissues and cells. Just the same as which, for example, if you are engaged into these physical activities, the cells are also releasing waste products. And those waste products may include specifically the reserved vitamins, minerals of the body. So that's why situations like when you're engaged into physical activities, most frequent you are voiding because the kidney are also active when it comes to the glomerulofiltrate rate, which the body is keep on increasing. The glomerulofiltrate rate is the one that induces urination. And with that, is there a possibility that engaging into physical activities and you will not increase fluid intake? Will you be at risk of dehydration? Will you be at
Yes
risk of
po.
Yes. So on that note, that is very significant that when you're taking multivitamins, the multivitamins is not used and indicated for treatment, but the multivitamins is to support as a supplement. And not all of the components and ingredients, sabi nga kahit yan Centrum from A to Z class. Ay sabihin pa it will be A to Z, not all the vitamins from A to Z needed by your body. So somehow some of the components are needed by the body, some are not because you still have the reserve. So what's the purpose of the liver? The liver will have this first pass effect to detoxify, then the excess components of the drug will be taken into action by the kidney, and it will be remove these excess chemical properties by the kidney through the urine. Question, sir. How about, sir, if the person is having kidney problem? If the person is having kidney problem, that will be your mindset na you have that Sir Miranda mentioned that there are two major organs that is very important when it comes to pharmacokinetics, the liver and the kidney. So whenever you encounter situation that the client has a problem with kidney and has a problem with liver, we will be more cautious. Because class, remember, if you read any drug literature and if you've heard about some of the drugs such as hepatotoxic, nephrotoxic, most of the drugs taken orally are hepatotoxic and nephrotoxic. That's why situations like if you encounter an overdose? If you encounter an overdose, do you think the liver will increase its workload so that to immediately detoxify the level of toxicity due to overdose? The answer is yes. Kaya that's why there could be possibility if there will be an overdose, the direct damage could be either on liver and kidney. So nurses, you must monitor that. Then after that, as mentioned with the ADME, the absorption, the distribution, the metabolism, and the elimination, which happens that the kidney eliminate those excess chemical properties. The after the drug had been metabolized by the liver, this is now the time that it will proceed to the next, which is pharmacodynamics. Plus, remember, the most that the drug reaches immediately in the plasma. Plasma is a component of of blood, right? Component of blood yan eh. We have the red blood cell, white blood cell, we have the platelets, we have the plasma. The plasma is responsible for carrying the nutrients to the cells, waste products of the cells, and the drug is carried by the plasma. So once the drug reaches the plasma, that is the time that this drug will be distributed to its indicated organ or system as well. So that's why, for example, you have taken ambroxol. You have taken ambroxol. Hindi naman yan, when you take ambroxol, it will pass through the esophagus and it has already its effect towards the lungs, towards the airway passages. Not yet. The drug, as it reaches the stomach, will pass through the intestine, detoxify by the liver, eliminated excess properties and chemical properties of the drug via the kidney, and that drug that is indicated for the body will be distributed pa lang towards the indicated organ, which is obviously the respiratory system, involving the upper respiratory tract to liquefy the mucus secretion that is the cause of obstruction when the person is experiencing coughing. That is the pharmacodynamics. Is when the drug reaches the plasma already, because that's the time, that's already the hint that the drug will act already on the indicated organ system physiologically. Kaya that's why the pharmacodynamics are terms that there is already biologic and physiologic response, okay? Biologic and physiologic response, then it comes out na yung mga indications nito. That's why usually in pharmacodynamics, the terms such as side effect, adverse effect, toxic effect are identified already. So, sir, what are the basic difference of side effect, adverse effect, and toxic effect? Class, when we say side effect, these are the expected, okay? These are the expected effect, expected physiologic effect of the drug. Example, if you have known anyone who's taking drugs ending in dipine, ano yung mga dipine na ito? Drugs like, example, ito very common to for those who may have hypertension. Amlodipine, pelodipine, nifedipine. Common, very common yung end na sa fixes, yung sa fix niya, di ba? It's dipine. One of the side effect of the drug is headache. Okay. Class, if you will take into consideration health education and teachings to your patient, it is very important for the nurse to orient the client on side effect. You are aware that the drug or the normal physiologic drug effect or the drug is already taking into effect to the body is considered a side effect. So if it is expected that the person may have headache, you must orient the client that he or she may experience headache after taking the drug. What will be the measure of the nurse? Since that will be an expected effect, but that's only temporary, ha? If the person already experience, or if the person will expect already headache, what will be the role of the nurse? The role of the nurse is to give health education to the client. Ma'am, you will experience headache after taking amlodipine. It is best for you after taking the drug to have rest period after taking the drug because you will experience headache as an expected effect of the drug. So if you will not explain this clearly to your patients, what will be their misconceptions? You give the drug, the nurse, the patient is oriented that it's anti-hypertensive. It's used to stabilize the blood pressure, and then the person experiences headache. Will you expect that the person have not been oriented with the action of the drug will have a problem with trusting relationship with the nurse if it is not well explained? The answer is yes. Nurse, you have given this drug to me to manage my blood pressure. But how come I am experiencing headache? Di ba some of the misconception goes like that. It seems that this drug is not treating or is not stabilizing my blood pressure because I am experiencing headache. What will be the gap or what are those gaps? The gaps probably the nurse did not oriented the client that she will expect to experience headache as a physiologic and biologic effect. The drug is taking into effect to the body already, but it's just only temporary. So next, how about if we're talking about untoward effect of the drug? Untoward, it means that it is not on the line. It is not on the list of the side effects. So if you observe that there are untoward effects of the drug, example, uh, example, vomiting. Vomiting, for example, is not listed as a side effect. So that considers as an adverse reactions. You need to do something. Why? Because class, if you will observe adverse reaction as an untoward effect of the drug, will you have this concept that it's starting to have harm or it starts to have harm to the body of the patient? There could be possibility that it goes on that situation, right? So on that process, there could be situations that if those are not side effects, if these are untoward effects of the drug, these are classified as adverse reactions or adverse effects. Eh sir, how about toxic effect? Adverse reactions, for example, sir, another example of adverse reactions are allergic reactions. Okay. Class, have you observed someone who's experiencing allergic reactions to a drug or to anything or food? What are the signs that you have observed if they are experiencing allergies? Yes,
Rashes
Miss
po.
Sipil. Huh?
Rashes po.
Rashes is
Rashes
one.
po.
Okay, rashes is
Then,
one.
another po is nahihirapan huminga.
Difficulty of breathing, correct. Any
Tapos,
other?
other severities po is, ano po, medyo nagkakaroon po ng parang puffness around sa neck po.
Yeah,
Yun po
okay.
yung sometimes na napapansin ko.
Okay. That's why it's thank you very much and you're correct. Do you expect when you give a drug, the client will have rashes? Who among you will say, "Ma, that's side effect. Rashes are side effect." You will not tell that to anyone. If anyone takes a drug and then rashes, what is your source that rashes are side effects? No. No reference at all that rashes are side effect. This could be probably either a sign of adverse reactions because rashes are unusual reactions of drugs. It is a sign of allergic reactions. And why the client is experiencing difficulty of breathing? Class, have you heard or even encountered when you give a drug or a drug has been administered to a patient, the patient will have difficulty of breathing? Headache could be, weakness could be, pero difficulty of breathing after taking the drug, it's not the usual and expected effect of the drug. That could be an adverse reaction. So that adverse reactions that we're talking about is hypersensitivity reactions, or should we say allergic reactions. And anyone who have who are experiencing allergic reaction may escalate to a higher level because the difficulty of breathing itself, class, anyone who has an allergy with a drug and may cause the possibility of constriction of the bronchi. That's one. Once it will constrict to the your bronchi will be constricted. Will this be life-threatening already? Will it be dangerous on the danger level already? It will alarm you na ba on that note? Answer. I haven't heard any answer.
Yes po.
Yes. So on that note, if for example you have observed that, oh, this is an unusual, this is not a side effect, this is very unusual response of the drug, you're thinking of adverse reaction, and it will alarm you. You need to do something, right? Because the possibility it may escalate to a life-threatening condition or dangerous level of situation. It may lead to severe adverse reaction, and that severe adverse reaction may lead to toxic level or toxicity. If it may lead to toxicity, can you imagine a person who is experiencing adverse reaction of allergic or hypersensitive reaction is experiencing difficulty of breathing? If it will escalate on a higher level of severe adverse reaction, which is toxic level, it will what? It will totally constrict the airway. Will that be Will that be life-threatening to the patient? If it will totally constrict the airway passages? Yes or no?
Yes po.
Yes po.
Will the patient be deprived from oxygen because of the constriction of the bronchi? Yes or no?
Po.
Yes
Will
po.
there
Yes
be
po.
a possibility that the carbon dioxide will retain inside the body instead of exhale? Yes or no?
Yes po.
Yes po.
Will
Opo.
there be a possibility that too much retention of carbon dioxide may lead to carbon dioxide toxicity?
Yes po.
Do you need carbon dioxide in your body? Too much carbon dioxide in the body?
Opo.
No po.
No, because
Yes
you
po.
need more oxygen. Will there be a possibility or a conclusion that whenever there will be too much retention of carbon dioxide, it may reach to toxicity? Yes or no?
Yes po.
If that may lead to toxicity, will it cause harm to the cell?
Yes po.
Yes po.
If it will cause harm to the cell, do you think it may lead to the deprivation of oxygen of the cell?
Yes po.
Yes po.
If it will lead to deprivation of the cell, do you think it will lead to the death of the cell?
Yes po.
Yes po.
And do you think if the muscle cells of the heart will lead into death, it may start its pump? It will inhibit its pumping of the heart? Will that be possible? And
No
there will
po.
be death of cells
No.
in the heart
No po.
for some instances. But if the major parts of the heart are already affected, then the possibility it will slowly because of death muscle cells death of the muscle cells of the heart. Then once it will extend the death of the muscle cells, then possibly the heart may not contract, the heart may not pump blood, the cells will be more deprived with the oxygenation. Will that be fatal and fatal, and it may lead to death of the patient?
Yes po.
Yes, that means that it already reached the toxic level of the drug. That's why every time that you will encounter that this is not anymore adverse reaction, because for example the client is, oh, you're experiencing difficulty of breathing, but the worst scenario is the patient is experiencing difficulty of breathing, then there is bluish discoloration already of the nail beds. Which is worse, a difficulty of breathing or a difficulty of breathing that has already bluish discoloration of nail beds?
Yung may bluish discoloration po.
Correct, because that's an indication that the level of oxygen and hemoglobin are definitely lower than the normal. And that may deprive all the cells of the body to function normally. So on that note, that may lead to the death of the patient. So that's why if you have heard about toxic level, you need to have a drug that may counteract toxicity. Anyone who knows what are those drugs that counteract toxicity level of drugs? Anyone? Anyone? You can search it on the search engines. The one that counteracts the toxic effect of the drug. It starts with letter A. So hoping everyone may know what are those drugs that counteract the toxic effect of drugs.
Antidote po.
Very good. Who answered that?
Papa po.
Okay, you're recognized. That's what you call antidote. Okay. The antidote is the one that counteracts the toxic effect of the drug. Just like, for example, have you watched any documentaries or any movies na somehow nakaka-experience ng poisoning? 'Di ba usually pag poisoning, extreme level of toxic na yan that really acts on the body. Have you seen situations that charcoal are being introduced? Charcoal, your charcoal, uling, and mixed with the saline solution, or with the saline solution, and introduced to the patient. The charcoal are being introduced to the patient because that is an antidote for drug intoxication and food poisoning. For overdose of drugs, makikita, you will observe in the ER, oh, why the nurse is preparing charcoal, and why it mixed it with the why it's mixed with the sodium chloride. Then it will be most of the patients who are encountering overdose or toxic effect, they will have the tube entered into the nasal going to the stomach, and they will introduce that black. And what is that black? Those black substances that are being introduced are charcoal. And charcoals are antidotes for usual food or drug toxicity that the patient experience, usually for overdosage. So on that note, when we talk about pharmacodynamics, pharmacotherapeutics, and pharmacokinetics, this will give us the idea on what we are talking about pharmacotherapeutics. When we talk about the pharmacotherapeutics, it talks about the indication of the drug. If we talk about pharmacokinetics, just remember the ADME, the absorption, distribution, metabolism, and elimination. And if we talk about pharmacodynamics, we're talking about the biological and physiologic response of the body from the drug, which is eventually those terms that we have identified are side effects, adverse effects, and toxic effects. Now, another learning outcomes that we may encounter, or that you may expect in our discussion, is discuss toxic effects of the drugs. When it comes to toxic effects, we have mentioned and defined this accordingly, that it's on a perspective that, again, it's life-threatening and it's already dangerous on the wellness of the patient. Now, the toxic effect of the drugs usually are manifestations that will really damage organs, that will really affect multiple organs, which is the system, and eventually may cause its toxin distribution to the different parts of the body. So, and under this discussion of toxic effects, we must be aware of what we call therapeutic level and toxic level. Class, remember ha, di ba class, if you have encountered a drug, di ba we have the prescribed dosage only per age. For example, di ba it's different dose for pediatrics and different dose for adult. Why is it? Because the children may have different response when it comes to the drug physiologic and biologic effects, same as with the different from the adults. So that's why for pediatric, Tempra can be given only 5 ml. But for the adults, it's 10 ml. Sir, why not na lang 5 ml, 10 ml also for the children? Again, if you give 10 ml for children, you're giving them paracetamol. You are definitely putting them into paracetamol toxicity. Sir, para mas mabilis yung effect, mas marami. The more, the merrier. Anong the more, the merrier? The more dose, the chances of toxicity the patient may have risk. That's why it's always computed according to weight of the patient. So ibig sabihin pala, sir, it may depend on the weight. Yes. The lesser the weight of the patient, the chances that the less of dose can be given. How can you imagine the patient who is underweight and be given a dose of higher dose? There could be a possibility on a problem with absorption. So that's why it must match with the weight. Kaya class, when it comes to pharmacology, always take into consideration the baseline weight of the patient. And if ever there will be computation of drugs, oh sir, may computation, may math. The computation of drugs is very important also for the nurse to do as to promote safety. Again, when it comes to the computation of drugs and computation of intravenous fluids, those coverage and concepts of computation of drugs will be introduced to you in the skills laboratory or will be taught to you in the skills laboratory. In our pharmacology lecture, we may not cover the computations. So the computations, all of the computations of drugs and intravenous fluid will be covered in your skills laboratory. However, let's go back. Knowing the toxic effects of the drug will keep the nurse have high confidence to prevent what? To prevent complications, to prevent the risk of patients towards mortality or death, and it may prevent the patient specifically on any organ damage. And one of the things that you need to take into consideration is that of you must be aware of the common antidotes that we have mentioned a while ago. As what I have told you, we have the list we have the list already and identified already of therapeutic level of drugs that the patient may have. If it will exceed to that therapeutic level, it's already toxic level. And that the nurse may decide or must, hindi pala may ha, must decide to withhold the drug or discontinue the drug even without the order of the attending physician. Next, differentiate the steps of the nursing process and their purpose in relation to drug therapy. Nursing process, we have the ADPI, very important. Why? Situations like when you give the drug to your patient, you need to do assessment. We have assessment, diagnosis, planning, intervention or implementation, and evaluation. Now, when you're about to give a drug, for example, those drugs ending in olol. Sir, say it again. Those drugs ending in olol. Example, metropolol, atenolol, propranolol. Those drugs have the same classifications. And what made those drugs clustered with each other? Regardless of the generic name of the drug, all drugs ending in olol, O-L-O-L, are classified as beta blockers. Beta blockers. O sir, kindly explain what is beta blockers and we will try to relate in nursing process. The beta is a receptor. If we say receptor, it has the capacity to transmit impulses, signals, messages. Okay. When for example, are you still aware of what is fight or flight? Can you still remember what is fight or flight in nervous system? Yung sympathetic and parasympathetic response, if you can still remember. No one is answering, but we will just recall in a bit. For example, in sympathetic response, usually when you are on the state of too much anxiety, when you are on too much anxiety or you experience severe anxiety, do you expect the heart will pump faster or slower?
Faster po.
Faster, very good. The next question, a follow-up question, why the heart contracts fast than usual? Is there anything how the heart contracts more than usual? Plus, when it comes to the heart, there is one organ that are closely related and associated with each other to regulate blood pressure. Can you name that organ that also regulates blood pressure? Anyone? What organ? Ovary ba? What? Intestine? No, 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 no,
Brain
no.
po.
Ha?
Brain.
Aha. Deeper. So organ, organ. Oh, organ. That is also responsible in regulating blood pressure. Although the brain, yeah, you have answered brain, right? Because the brain has also the part in the lobe that specifically controls blood pressure in the heart. But specifically when the heart will require to meet its demands, one organ is responsible of releasing adrenaline. You can answer in the
Kidneys.
chat.
Kidney po daw.
Kidneys po, sir.
Kidney. Okay, that's good. Thank you so much. Obviously, that's kidney. Do you know that kidneys, adrenal glands are releasing adrenaline? And this adrenaline or epinephrine are released are secreted by the adrenal glands, by the kidneys, and it will be transmitted with the receptor, or the signal will be transmitted via beta receptor. The beta receptor is the signal that will what? That will connect the heart, that through the epinephrine or adrenaline, it will increase, it will facilitate and stimulate fast increase muscular contraction of the heart. So, it has really a connection that the beta receptor is the one. For example, the adrenaline or the epinephrine will not be controlled its release. The one that transmit the signal is the beta receptor to the heart. So let's see. So this is now the situation. Do you know situations like goiter, hyperthyroidism? Are you aware of that? The
Yes
goiter?
po.
Yeah. Usually, if you have known individuals who may have hyperthyroidism, usually most of their complaints are palpitations. Do you know what palpitations is? Do you know
Yes
palpitation?
po.
What does palpitation mean? It is usually the forceful contraction of the heart, which the person can verbalize and feel it, right? The person may verbalize na, Dok, parang ang bilis ng tibok ng puso ko. So nakakaramdam mo yung kabog ng puso, which is the forceful contraction of the heart, which is eventually may cause the possibility that too much forceful contraction of the heart may increase oxygen demand. Oh, here comes the point. Since on that situation of a person with goiter, and it may not control the release of epinephrine, and it may cause harm to the heart because it may increase oxygen demand, the one that can be blocked is the beta receptor. So if the drug will block the beta receptor, do you think even the epinephrine will be released by the adrenal glands? It will increase the force of contraction of the heart? The answer is not anymore, because the drug itself, the olols, the drug itself may facilitate to slower down the heart rate to its stable condition. Kasi nga, too much forceful contraction of the heart may cause the increase in the oxygen demand. That what happens in the patients, or to those patients who may have hyperthyroidism. Kasi any hormones that are increased may increase metabolic response. And once it will increase metabolic response, one of which affected is release of this adrenaline. And it will cause forceful contraction of the heart, which may have a harmful effect. So to prevent the harmful effect, we cannot prevent the heart to pump. Obviously, the patient may die and cardiac arrest will happen. So what will be the drug that can be given? The drug can be given is beta blocker. It may block the beta 1 so that it may not anymore transmit the signal of releasing the adrenaline. Oh, here comes the point. What is the normal, let's go back to nursing process. What is the normal cardiac rate?
60 to 100.
60 to 100. Very good. Now, you will give an olol to the patient. And that's beta blocker. And the cardiac rate is 53. The cardiac rate is 53. what the nurse will do. Will the nurse administer the drug since it is prescribed by the doctor? B, the nurse will withhold the drug because it is less than 60. Or C, will ask the patient if she will receive the drug. Which of the three responses could be the appropriate action?
B
The
po.
answer is letter. Very good. The letter B could be the appropriate answer simply because you will withhold the drug because it's less than 60 as normal. And what is the action of the beta blocker? Diba the beta blocker will slow the heart rate? Will it be possible that if you still give the drug, it will aggravate ba the lowering of the cardiac rate? It will trigger ba? Sabi nga sa mga YouTube vlogs, triggered. It will be triggered ba na maglalong bumaba? It will lower down further the cardiac rate if the beta blockers will be given. The answer is yes. And if it will lower down further the heart rate, will the patient possibly experience cardiac arrest?
Yes po.
Yes. So will if you give the drug and the patient experience cardiac arrest rather, are you responsible for it? Will you be accountable for it?
Yes po.
Yes po.
Yes, because in your perception, the cardiac rate is not normal. The action of the drug is it will slower the heart rate. So very obviously, the drug itself contributes eventually in slowing the heart rate, and eventually the client experiences cardiac arrest. So with those analysis, you need to have the assessment. The vital signs are very, very important for you to decide. Withholding the drug may not definitely need doctor's order. It's your independent function to withhold the drug because you have already the knowledge power to justify and validate that it may cause harm to the client and sooner may take into situation of life-threatening conditions of the client. So on the process, like application again of nursing process, why we are not just only checking the vital sign at the start. We're also because at the start it's considered as the baseline. As it goes that the drug is taking into effect to the client, the nurse must still continue checking the vital signs. To what extent? To monitor adverse reactions. To monitor toxic effects of the drug. If it already, for example, at the start, the vital signs are stable, you have given the drug. But after an hour, after 2 hours, the client had the cardiac rate lower than 52. So the nurse must be alarmed with it that within an hour or 2 hours, the client experiences a problem with decrease with bradycardia. So there must be something wrong. So you need to recheck, you need to revalidate the vital signs, and if it is confirmed that these are already adverse reactions, then it must do something to prevent its escalation towards toxic effect. So that is significant. That is the significant role of the nurse. And that's why when it comes to the steps on the nursing process, when you will encounter case presentations and case studies, I know you may be aware and be oriented about this. Nursing process is very significant and drug study is very significant. It is not just only putting all the details and information about when you are engaged into drug study, but putting into the situation what could be the relevant roles and responsibilities of the nurse to prevent such adverse reactions, or if adverse reactions were not prevented, how to prevent toxic effect of the drug. Next, discuss safety guidelines for drug administration. First and foremost, the highest priority why we're studying pharmacology is all about safety. Just like in the United States, they are implementing 5 rights of medications. And here in the Philippines, we have 10 rights of medications. In the United States, simply they're using the 5 rights of medications, pero it's the most important rights of medication. What are those? We have right patient, right drug, right dose, any other, right? So we have the right patient, the right drug, the right dose, the right time, and the
Right
right
route po.
route.
Route.
Yan. These are the 5 very important when it comes to administration of drug. Simply the number 1 is right patient. So very obvious, you may, if you give you are aware of the computation of the dose of the drug, you know the route of the drug, you know how to administer the drug, you know basically the classification of the drug, but you did not give it to the right patient. Oh, come on. You will now see in the Google your name versus the people of the Philippines. Why? Because you may have a possible case of negligence because you cause harm to the client. In the United States, they are very particular with every single errors that you may commit, most specifically in drug administration. Most of the patients that you may encounter in a ward or in any facility are long-term, are on their long-term treatment, and most probably are very familiar and aware of indication of the drug. You will be tested. So that's why every time that you will face a client, you are prepared specifically on drugs that you are administering. And with that, because you need to take this into a mindset because you are promoting safety. So these are the learning outcomes that we considered in the studying of pharmacology. So when we talk about the pharmacology, we are talking about this term as pharmacon and logos. Kasi usually when you encounter logo, psychology, biology, logo, terms as the study. And the pharmacon itself, obviously, is the term that basically identifies the drug. So why pharmacology is being studied, not just only its classification? The preparation of the drug, the properties of the drug, the uses and actions of drugs are covered in pharmacology. To what extent? Sir, the level of competencies ba of pharmacists could be different from a nurse. Technically, yes, because they are more in depth when it comes to chemical properties of the drug. They are more in depth when it comes to the study of adverse reactions of the drug. But with us, it could be an advantage. It may have, if we may have the in-depth knowledge on these drugs, because again, our purpose and existence in giving drug administration is basically safety. When it comes to the preparation, we are talking about here that there are drugs that may need it may need right preparation. To what extent? Example, there are some drugs in any form or in forms like syrup, tablet, capsule. By route, it could be given oral. It could be given intramuscular. It could be given intravenous. With those different routes of administration, will it entail different preparation mechanism? The answer is yes. When you are about to prepare a drug which is for oral medication, then you must be aware on how to administer oral drugs. When you remove the drug on its packaging, much you must not touch the drug, because possibly there are some drugs that are sensitive and may lose its potency or effect. For example, are you aware of salompas? Yung the one that is used for muscle relaxant. There are some situations that the drug itself yung mismong drug component itself are on the other side of the sheet. Once you will cause a touch on that area, will it affect the level of potency? Possibly, based from findings. But there are some situations that the client are experiencing chest pain. We have the patch that is placed on the part of the heart. If the client contraindicated po ang oral and there is still no intravenous site that are being done to the client. So the patch can be placed on the anterior chest wall of the patient's obviously chest. Class, when you prepare the drug and touch the side that has the part of the drug, it may lose the potency or effect of the drug. So that is a more sensitive drug that you may need to know, because somehow you may not take it in consideration. You just place it on the chest, but once you have touched it, okay, it may lose the potency of the drug. Another when it comes to the preparation. When it comes to the preparation, there are drugs that must be refrigerated. There are drugs that must be that can be stored only on room temperatures. So those are basic concepts that we must understand, that when is the time that the drug is not anymore potent, it's not anymore effective. Example, usually when you dilute a drug for intravenous in a vial, usually it's colorless. Usually colorless ang magiging outcomes niya. And usually those remaining drugs that can be used on the next phase of administration will be refrigerated. If this colorless diluted drug in a vial change its color into dark color, will you be alarmed? Will you be alarmed? Yes, kasi the usual preparation, once it's diluted, it's colorless. And then, why it change its color even refrigerated? So that is an indication that the drug itself is not anymore potent or effective because it's already changed in color. The change in color itself may give us the idea that the drug is having a change in the chemical property which may not be effective for the client. Why do we need to know its actions? The trusting relationship with our patients is very important because we are the first one as frontline to be asked about the classification of the drug. Moreover, we are the ones who are giving health education to the client who are expecting for side effects. Another, it's always take into consideration that in pharmacology, it integrates the concept of science. We are aware, even during our elementary and basic education days, science had been introduced to us as what? Science is defined as a systematized body of knowledge. Do you agree with me? It's a systematized body of knowledge. That's why usually when we encounter science, it always conclude experiments. It always part of the analysis and critical thinking that are being expected in science is mainly on the experimentation. Just like integration of science is on a way for us to understand that the drug itself, once it enters the body, it must be expected to take its effect as on its orientation and based from its clinical trials. I know you are aware of those clinical trials. Class, if the drug are not if the drug's clinical trial is not yet completed, it must not be circulated in the market commercially or hindi pa to pwedeng ibenta. So that's why, class, do you even analyze na the COVID-19 vaccines is prohibited to be sold? Why? Because we are still on clinical trial 3. That clinical trial 3 is still on the study and trial to humans on the effect of the drug. That's why, di ba, you are being asked when you have been vaccinated, there is an online helpline to report if there are adverse reactions of the vaccines. Why? Because we are still documenting if the drug's efficacy is the same clinical trials that had been done abroad. So that's why we have been introduced of efficacy or efficacy of the drug. The efficacy of the drug that had been oriented, sabi natin, we go for Pfizer because it has 95% efficacy. I don't want Sinopharm. I don't want Sinovac because it has only 70% efficacy. But class, those studies were conducted not for Filipinos, not here in the Philippines, but those studies were conducted on other countries and with other people. Although the clinical trial studies itself had been approved with the Food and Drug Administration to be safely administered to Filipinos because they will be given emergency utilization authorization. It's a emergency use authorization because of the extent that it will be given to humans already. Pero again no one must sell vaccines, COVID vaccines, because it's not yet reaching clinical trial 4. So eventually with the clinical trial 4, which will be discussed in your asynchronous, will be your knowledge. Oh, so those drugs that are over the counter are what, that's why they are over the counter, because it reached already the what we call level 4. They have passed level 4. Etong level 3, if you will notice, there are some populations that are not being included. Just like have you encountered those individual or pregnant women who have been vaccinated? Have you known pregnant women who have been vaccinated? Not yet, because when in the what we call in the clinical trial 4, that's the time that they will test naman ito. Kasi pag clinical trial 3, they will test it in the adults Kasi yun yung population groups that are done in other countries. But there are no studies yet that the vaccines are being given to pregnant women. So that's why it's not given to pregnant women. So those are the concepts why clinical trials are very important concept when it comes to receiving vaccines. Because at this time, most of the vaccines being administered to Filipinos are on EUA, emergency use authorization. And if it passed on the level 4, it means that it is safe for children, if it is safe for adults, if it is safe for pregnant women, then that any pharmaceutical company can release commercially vaccines. But as of now, we still don't have any concrete evidences. So that's why it's still for free. And the manufacturing companies may have the responsibility if ever there are some situations that arise as adverse reactions. Okay, talking about adverse reactions, the properties and reactions of drugs, especially in relation to their therapeutic value. Class, since we're talking about its reactions, the adverse reactions and properties are very important. Example, are you familiar with Neozep? You're familiar with Neozep. Neozep is for
Yes
flu,
po.
right? In Neozep, if you will check the generic name of Neozep, it has multiple components. Example, it has paracetamol, it has phenylephrine, it has chlorpheniramine maleate. So there are three components on the generic of Neozep. Now, if for example, your patient had been identified with allergic reaction on paracetamol, will you still give the drug? Will you still give the drug? Even one of the components lang naman yung paracetamol, hindi naman what I meant is hindi naman the patient may not be have allergy on the chlorpheniramine maleate, phenylephrine, but paracetamol may have. So probably with the logical thinking of a nurse, you will withhold the drug. Why? Because the paracetamol itself, if the patient has identified with allergic reactions or a history of allergic reaction with paracetamol, you will not take risk because eventually you may expect the client may have signs of allergic reaction, and if you are aware that the patient has the history, then it will be your responsibility and accountability. That's why nurses, before you give any drug to your client, always ask for any history of allergic reactions or conditions that may be contraindicated. Class, di ba we are aware that not all drugs can be taken by a pregnant person? Di ba not all drugs can be taken?
Yes po.
Yes, because on the perspective that it may lead to adverse reactions to fetus. So that's why if you will see in the drug literature of the client contraindicated to pregnancy, don't even attempt to give the drug because the contraindication itself is based from the study that it will take risk to the pregnant mother and to the fetus itself. Okay. Now, this is the concept that we have discussed a while ago. We have pharmacokinetics, pharmacodynamics, pharmacogenomics, and pharmacotherapeutics. With the divisions of pharmacology, I even introduced to you what pharmacokinetics is. And I have utilized also terms starts with M to keep you abreast or update easily of what does these divisions of pharmacology meant. If we talk about pharmacokinetics, as what I have mentioned, this is related to the movement of drug from the route of administration up to the elimination. So that's why we have the mnemonics ADME. Oh, can you still remember what the ADME I mentioned is? A,
Absorption.
Absorption.
letter D,
Distribution.
Distribution.
M,
Metabolism.
metabolism, and E,
Excretion or
excretion or elimination. Very good. When we talk about anything that is related to ADME and movement, we're talking about pharmacokinetics. When we talk about the drug route or route of administration is intravenous, it's still related with pharmacokinetics. You have given the drug topical by skin. It is still related with pharmacokinetics. The drug components are break by the hydrochloric acid in the stomach. It is still in the pharmacokinetics. If it is within the boundaries of concepts of absorption, distribution, metabolism, and elimination, and this will be further discussed as we go on with our discussion. When it comes to the pharmacodynamics, we can use mechanism. That's why if you've heard about drugs, what is the mechanism of action of the drug? Ayan. If we say mechanism of action with the drug, as what I have told you, this is all about the biologic and physiologic response of the drug already. That's why we have already identified yung, di ba, side effect, adverse effect, or reactions. We have already identified toxic effect. Because usually these effects happens during the time of pharmacodynamics. And usually, these drugs may give us idea also that there are some drugs that may not be mixed with other drugs. There are drugs that may not be mixed with milk. There are drugs that may not be mixed with a certain food because it may counteract its effect. So that is what we call pharmacodynamics. We're talking about the biological and physiologic response of the body pertaining to drug. How about pharmacogenomics? If we say pharmacogenomics, it talks about makeup genes. Okay, if we say makeup genes, class, is there a possibility that the drug may differ its effect from a male and a female? Will there be a possibility? Will there be a possibility that a drug may have a different, may vary somehow an effect with a male to a female?
Yes po.
Yes, why? Example, typical concept on hormones. Do hormones vary its composition, its physiologic composition with a male and a female? It may vary ba?
Yes po.
Yes. So there are common hormones that are also present in males that are also present in females, but the level is different. Example, testosterone. Familiar with testosterone? Testosterone are present in both male and female. But which of the gender
Male po.
identified? Male. Okay. Higher ang testosterone for male. So lower ang testosterone for female. How about with this level? Kaya that's why pag higher ang level ng testosterone, di ba usually the hair growth is much prominent for male, right? Mas prominent ang male ang hair growth over the female. So if a female has an overgrowth of hair sa body, that's an indication that testosterone could be increased. So that may vary. So for an instance that if the client is taking testosterone hormone pill, that may vary difference when it comes to the effect with female and the male based from studies, because again both genders may have testosterone, but the level of testosterone vary with each other. So that's the difference with pharmacogenomics. The pharmacogenomics also may give us the idea of what you call this inherited diseases. Example, most of the situations like familial, yan, yung mga familial diseases. Why we always ask, for example, if the patient has hypertension, why you always ask, are there any history of hypertension with the family? Yan. Kung for example, if there are blood disorders, are there any history of blood disorders with the family? If yes, then what will give a hint to the nurse? It will give a hint to a nurse na, for example, doc, the patient has a history of blood disorders and we are giving a drug that may affect physiologically blood level. Is there a possibility that we could have first the serum or blood evaluation prior to administration of drug? You will be promoted in 1 day for head nurse. Why? Because the level of confidence that you may have could be appreciated. To what extent? If for example, nurse, please give the drug to the patient. Or you ask the patient, ma'am, you have history of blood disorders po ba? Then the patient will respond, yes. Ma'am, we'll just give a drug po ha. We'll just give a drug. This is prescribed by the doctor. The patient took it. The patient experienced bleeding. And the nurse identified, as responded by the patient, that she has history within the family of blood disorders. Will that be an accountability of the nurse? Yes or no? Will that be an accountability of the nurse? Yes, because the patient and drug history itself matters in administration of drug. So that's why familial history is very important in the administration of drug. Fourth, we have the pharmacotherapeutic. When we talk about pharmacotherapeutic, this is the level wherein the term used as maximum. If we say maximum, di ba? If we say pharmacokinetics, it's still the drug is still taking into action sa body. Pharmacodynamics, the drug is leading to its indicated organ. When the drug already reached to its indicated organ system, the drug is already reaching its maximum effect. Example, let's go back to ambroxol. From the ambroxol itself, when the drug itself is carried by the plasma in the respiratory system and taking already the action to liquefy the mucus secretion, that is already pharmacotherapeutics. When the drug already reaches the respiratory system and its indicated action is to relax the bronchial smooth muscle to alleviate difficulty of breathing, that's already pharmacotherapeutic. When the patient is experiencing fever and improve the temperature already, that's already pharmacotherapeutic. When the person is in pain and on a pain scale of 8 and identified already with 4 or 3, that's an indication that the drug already reached its maximum effect. That's pharmacotherapeutics. Now, we will end the session as promised with questions. And these questions are self-assessment exercises that we will do every discussion that we may have. So we want because all of you are open to answer. You may raise your hand once you wish to answer. I will reveal the questions. The nurse who is caring for a client explained the movement of drugs into, through, and out of the body. We have pharmacokinetics, pharmacodynamics, pharmacognosy, pharmacotherapeutics. So I think the first one who raised the hand is Miss Papa. Answer.
Pharmacokinetics po.
Your answer is pharmacokinetics. Follow-up question. What made you decide, what hint you in the question for you to lead with the answer of pharmacokinetics? What is the key term that you have seen in the question?
The movement of drugs.
The movement. Okay, let's see and reveal the answer. The answer is pharmacokinetics. So next question. Pharmacokinetics can be simply described as the study of what the body does to the drug, except when you encounter questions in the board exam or even in international examinations, always take into consideration, because somehow this may mislead you in answering questions. If it is except, you are looking for incorrect statement. Okay? So let us reveal. So ibig sabihin, on the concepts of pharmacokinetics, which of the following best describe pharmacokinetics? The rate and extent to which drugs are absorbed in the body and distributed to the body tissues, the rate and pathways of which drugs are eliminated from the body by metabolism and excretion, C, the relationship between time and plasma drug, D, the drug produces biochemical and physiologic changes. I think the first one who raised the hand is Miss Pelin. Miss Pelin?
Sir, ano po ba? C po ba?
Letter C? Sige, I'll give you a chance. I'll give you a chance. Again, we're talking about pharmacokinetics. So the next one, I'll give you a chance. We will reveal the answer later. The next one who raised the hand is, we have Miss Papa Fides.
Letter D po.
Some with letter D. Okay, sige. Okay, ganito po. These questions somehow may cause confusion. Even the first time that I have encountered this question, I answered letter C. Okay, I answered letter C. But on the situation, if we say pharmacokinetics, di ba I have introduced to you ADME. Absorption, distribution, metabolism, elimination. Ngayon, when we talk about this ADME, in letter A, is it reflected all about anything related to ADME? The answer is yes. What are the two terms? What are the two terms that will guide you that this statement is connected to pharmacokinetics? It's absorbed. Yes, and the other one is
Distributed.
distributed. Very good. So it means this statement is correct. Letter B. What terms made you guided that this is a correct statement?
Metabolism and excretion po.
Okay, correct, Ms. Tanghal. It's metabolism and excretion. Now, sir, in letter C, it doesn't indicate ADME. Remember, class, di ba? The one that I have emphasized to you, that in pharmacokinetics, from the time that the drug is being introduced to patient until it reaches the plasma. Did I mention that? Di ba? Once it reaches the plasma, that is already still part of pharmacokinetics. But if we are talking about if the drug is already having its physiologic effect, di ba? Yan yung term natin, di ba? Physiologic at saka biochemical and biological effect changes sa body. This pertains to pharmacodynamics. Di ba? Ano yung term na ano natin? Yung physiologic at saka yung biochemical or biological. So the answer is letter D. Except because this pertains to pharmacodynamics. Next question. The nurse is aware that the maximum use of drugs, ang bilis the maximum use of drugs to treat a specific disease or produce a desired effect. Tingnan natin yung term Tingnan natin muna. Pharmacokinetics. Pharmacodynamics. Ang bilis ng reflexes Yun talaga, lahat ng reflexes sa PEDYA. I don't know kung na-discuss na yung mga reflexes sa inyo. Alam ko na-discuss na sa inyo yung reflexes. Pharmacodynamics, pharmacogenomics, and pharmacotherapeutics. So Ms. Tanghal is the first one who raised her hand. Answer.
Hindi po. Pharmacotherapeutics.
What made you guided that your answer is pharmacotherapeutics?
Maximum po.
Maximum. So let's see, the answer is pharmacotherapeutics. So again, pharmacokinetics is movement, pharmacodynamics is mechanism, pharmacogenetics are makeup genes. Next question. The nurse noted a harmful, unintended reaction of the drug, which refers to desired effect, adverse effect, toxic effect, or side effect. So maybe I'll give a chance to others other than Miss Papa. Siguro I'll give chance to Mr. Mateo.
Letter B
Eugene?
po. An adverse effect po.
Adverse. What made you decide to have this adverse? What are the key terms? What are the key
Unintended
terms?
reaction po.
Unintended. Okay. Harmful na tapos unintended pa. Hindi ba toxic effect? Hindi ba toxic effect? So tingnan natin. Sige, we'll reveal. The answer is adverse effect. Huwag naman magbabago. Sinabi ko magbabago na agad yung tahimik na. But I do understand. Kasi somehow, di ba, it may cause confusion yung adverse effect tsaka toxic effect. But remember, when you encounter questions that the adverse effect and toxic effect are choices, yung toxic effect higher level yan. Magre-reach na yan sa life-threatening, danger conditions, severe conditions. Ayan na, toxic effect na yon. So pag sinabi natin desired effect, the desired effect is also the same as therapeutic effect. That's the indication of the drug. If we say desired effect. Okay, thank you. Next question. The nurse notifies, ang bilis the nurse notifies the physician due to serious adverse reactions that occurs when plasma concentration of the drugs reaches dangerous and life-threatening. We have side effect, we have adverse effect, we have toxic effect, and we have desired effect. I may call on the first hand that raised is Miss Prestosa, Katrina May.
Letter C po, toxic effect.
Toxic effect, tignan natin. The answer is toxic effect. Kaya remember class, pag toxic na sa buhay, i-end na ang relationship. It's not anymore healthy. Kaya remember in life, if the relationship is already toxic, it's already life-threatening. So tandaan nyo yan It's already life-threatening. It means that beyond your consciousness, ikaw na lang pala ang nagmamahal. Yes! Next question. Self-assessment exercise. Bilis The nurse emphasized in her health teachings on the reduction. Reduction to Reduction on effectiveness of medication in treating a disease or condition that refers to. Ako sir wala kang sinasabing ganyan. Drug tolerance. Drug resistance. Drug dependence. Drug abuse. Class, put this in mind Not everything that I say in a discussion are expected to be part of the board exam. Kaya that's why if there are questions that will be included, you will be wise in having the best answer. Hindi naman na-discuss to ni sir eh. Nakaharap ka na sa question pag sa board exam. Will you stress yourself? Hindi naman ito nabanggit ni sir ah. It's the best time for you to consider your analytical and critical thinking. Let us analyze the question. Reduction in effectiveness. Di ba? Reduction in effectiveness in treating or condition that refers to. Let's have a trial answer. Mr. Jude, a trial answer on this.
For me po, drug and resistance po.
Drug resistance. Kasi anything in mind why drug resistance?
Reduction in effectiveness of medication po.
Okay, kasi 'di ba you're
Parang
familiar with
immune po, ganun po.
correct? You're familiar with the campaign of the WHO about antibiotic resistance kasi 'di ba do not do self-medication on antibiotic kasi possibly it may lead to antibiotic resistance. Pwede. How about for the others? Any trial so that to explore, just to explore responses lang. Miss Papa, do you have any answers on this? Different from drug resistance? Nag-lower hand na si Miss Papa. Miss Papa. Any other answer? So it means majority of you have this drug resistance. Let's see. Let's see if it's correct. Okay, correct. I have not mentioned it, but you technically analyze it through the question. You're correct because the reduction of effectiveness itself is drug resistance. Ibig sabihin, if ever you take the drug, if it is resistance, ibig sabihin there's no effect at all. Kaya again, by the WHO campaign, no to self-medication on antibiotics. What do you mean by drug tolerance? If we say drug tolerance, from the term itself tolerance, there are some instances na each one of us can be tolerated on a certain drug, can tolerate situation on a relief of a discomfort. Example, pain. Some of you may not have pain relief by paracetamol. Diba? Some of you may not have pain relief with mefenamic acid. Some of you may not have pain relief with ibuprofen. So the drug tolerance that we're talking about is that, for example, you have given paracetamol because that's the only drug available for pain. But the patient himself, there's no change when it comes to the level of severity of pain. So ibig sabihin, the person is not tolerating the drug. Pag sinabi naman natin drug dependence, the person is not anymore reliant na siya. He always rely on drugs. He always say na you are experiencing pain. O sige, you do deep breathing exercise. No, I want to have the drug already. That's the only relief to the pain that I am experiencing. So somehow, for example, they may say na I may only be calm with Valium, nothing else. So yun, drug dependence na. Pero pagka if the drug is already is taken beyond the dose itself, the prescribed dose itself, and beyond the frequency and time itself, that's already drug abuse. Okay? So next question. The nurse assists the client after taking the medication on the expected physiologic response that is unrelated to the desired action of the drug. Unrelated siya pero expected physiologic response. We have toxic effect, we have adverse effect, do we have side effect, or do we have desired effect? So I think the first one who raised the hand is Miss Prestosa. Katrina May?
Letter C po, side effect po.
Okay, so with the letter C, what are the terms that made you guided in the question to answer side effect?
Expected po.
Expected physiologic response. Okay, the answer is side effect. Okay, next question. The nurse understands that the ability when the client endure ordinarily injurious amounts of a drug or the lowering of the effect obtained from an established dose that requires raising the dose to possibly toxic level to maintain the same effect. if you will read this type of question, confusing. At the time that I have encountered this question, it made me read again 3 times. Ano daw? That is my initial reaction. The nurse understands the ability when the client endure ordinarily injurious amounts of drug or the lowering of the effect obtained from an established dose that requires raising the dose to possibly toxic level to maintain the same effect. Same reaction. Ano daw? So what will guide you is definitely get those terms or part of the questions that will guide you. So let's proceed with the choices. Is it drug reaction? Is it pertaining to drug dependence? Is it related to drug effect? Or is it related to drug tolerance? So this is a question that had not been introduced to you. This is the first time that you will encounter. So let's try. Probably let's try Miss Ortega who raised her hand. Alisa. Miss Alisa.
Letter D po. Drug
Letter?
tolerance.
Drug tolerance. Okay. The one that I have mentioned a while ago about drug tolerance is, for example, it's either the first dose cannot be tolerated by the patient. So possibly there could be a higher dose that can be tolerated by the patient. So singly yung situation goes na I cannot tolerate 5 milligrams. Nawawala ang pain ko 10 milligrams. But still on the acceptable level na hindi naman magre-reach sa toxic. It will still have the maintain the same effect. Let's see if that is the ano. Okay, correct. Miss Ortega, it's drug tolerance. The drug reaction we're talking about is related to either its side effect, drug reaction, or toxic reaction. And the drug effect obviously is referring to the efficacy of the drug. Next question. The nurse observes the client on the physical and psychologic reliance on the chemical agent resulting from continuous abuse or addiction, therapeutic, drug dependence, drug interaction, desired effect. Ito most probably, sir, do sa first part of the question, you mentioned about reliance. Ay, ako, reliance, ano na yan? Mag-drug abuse na yan. Pero somehow, di ba sabi ko sa inyo, it may result pa lang yung question eh. Resulting from continued. Pag continued use, dun pa lang papasok si abuse or addiction. So don't be confused. So obviously, let's have Miss Micaela Llaneta.
Drug dependence po.
Drug dependence. So let's see if the answer is correct. The answer is drug dependence. So obviously it's not therapeutic effect because it's not the indicated action. It's not drug interaction obviously because it did not state in the question on the any drug that counteracts with each other, and the side effect is almost the same with letter A. And what is the term that guided you to have drug dependence? It's the term reliance. You always rely, you always depend. Oh, yun. Okay, thank you very much. Next question. Okay, I think it's already ended to that effect. So the next discussion that we will do will be this coming Friday. Okay, this coming Friday, and continuation of our discussion. And we will have our first quiz. What? We will have our first quiz. The first quiz this coming Friday will be 10 items. It will be multiple choice. Okay, so the coverage of the first quiz in our prelim are those that have been discussed on the portion that I have covered in the discussion. So 7 to 8 is a synchronous session, and you may watch the link. But again, as what I have mentioned to you, you may have the leeway on the submission of the task until Sunday. So I will stop the recording.